Hi, my name is Dr. Frank Welch, and I'm one of the medical directors at the Louisiana Office of Public Health. Congratulations on receiving your first shot. That is the first step and an incredibly important step in helping us minimize this pandemic. It's going to decrease your chances of getting COVID, but most importantly, your chances of having severe illness, meaning hospitalization or death, is going to be significantly less and almost none. So getting the vaccine will actually protect you, your family, your coworkers, and your community. It decreases the chance that COVID will spread within those subgroups to other people. The COVID vaccine has been tested and shown to be effective in multiple age groups, in racial and ethnic groups, and both sexes as well. For the next 15 minutes, I want you to just sit and wait patiently. For the vast majority of people, you will have no problems and no reactions at all. As you watch this, healthcare professionals at this site are observing you to make sure everything is okay. That's because if something were to happen, it would happen quickly, within 15 minutes after getting the first shot. Things that we're looking for, and if you experience these, please alert someone, are facial redness or flushing, an increased or rapid heartbeat, or shortness of breath. But relax, reactions like these are extremely rare, but we want to make sure you're okay before you leave. If you've been asked to wait longer, maybe for 30 minutes, that's because you told us that you have allergies or have had an allergic reaction to a shot or to some medication in the past. The longer wait gives us more confidence that this vaccine is not going to cause you any problems. If you're worried, please try and relax. You'll have significantly less chance of getting an allergic reaction from a COVID vaccine than you would from a flu shot. So over the next 24 hours, you might have some side effects from this vaccination. The most common one is a sore arm. You might get a headache, a low-grade fever, some muscle aches. These are pretty common. In the rare case that you have an allergic reaction after leaving this site, you should do one of two things. For a mild reaction, call your doctor or another trusted medical provider. If the reaction seems serious, call 911 or seek emergency care. There is a lot of information on the internet about allergic reactions and COVID vaccines. What I would recommend is that you go to a trusted source like the CDC website. So, depending on the type of vaccine you got, you might need a second dose. If you got either the Pfizer or Moderna product, you will need a second dose of vaccine. If you get the Pfizer vaccine, you should plan on getting your second shot 3 weeks or 21 days after today. If you received a dose of the Moderna vaccine today, you'll have to wait 4 weeks or at least 28 days before getting your second shot. For either vaccine, don't worry if you can't get an appointment for your second shot at exactly 3 or 4 weeks. The important thing is that you wait that minimum interval between vaccinations. You can go several days to a couple weeks to get that second dose, and it will not affect the vaccine. So, there is several new vaccines on the horizon that may be coming out soon. These vaccines require only a single dose. If you received one of those vaccines, you're all done. But still, be sure to get a phone number to call if you have questions. After you complete this short wait and are told you're free to go, you must do 3 things. First, make sure you get your shot card with the correct vaccine that you received today and the date. Secondly, make sure you schedule a follow-up appointment to get your second dose of vaccine if that's necessary. And third, make sure you get a contact number in case you have questions to follow up. Also, don't forget to put the information about your vaccination into your phone or calendar, whatever you use to track your appointments. Use this time to actually maybe take a picture of your shot record with your phone. As I said earlier, getting this vaccine is the most important step to keeping you safe and bringing an end to the spread of COVID. All the vaccines against COVID are very, very effective at preventing serious illness, hospitalization, and death. This doesn't mean that you won't get COVID in the future, but your disease will be much, much milder. It'll be like a regular cold. Unfortunately, in that situation, you may still spread the virus to other people. Some people ask what they can do now that they've been vaccinated, and can they relax some social distancing rules? And the answer is no, not yet. Even though you got your vaccination today, and we think that will protect you from getting sick, it may not protect you from carrying and or spreading the virus to others. Because of this, we still want you to follow all social distancing recommendations. Wear your mask, wash your hands often, keep a safe distance from others, and be thoughtful and careful about going places where other people are gathering in close groups. It's important to follow all federal, state, local, and business regulations for social distancing as well. We'll let you know when you can relax these. COVID-19 is a new virus, and we're learning more about it each day. For instance, we don't know how long someone who got sick with the virus and recovered will have natural immunity that will protect them. We also don't know how long the protection you get from today's shot will last. It may last a year or longer, or it might be less. It is entirely possible that COVID vaccines will be like the flu vaccine. We may need to get one every single year. We hear about the variants that are coming out. New vaccines may cover these variants, so it's entirely possible you may need a booster or another vaccine next year. Some common questions that I get include whether the COVID vaccine will give me COVID, and the answer is absolutely not. The vaccine does not contain any live virus and cannot give you coronavirus. The second question I get is, will I get a positive test for COVID after getting the vaccine? And the answer is yes, depending on which type of test you get. In the first situation, if you get an antibody test for COVID after getting the vaccination, it will come up positive. That's what we expect, and that's what we want. That means your immune system is fighting off COVID from the vaccination. But the vaccine takes about 14 to 28 days to really become effective. If you have been exposed to someone with COVID, or if you fall ill, it's important to go get a PCR or a viral test. If that test is positive, that means you do have the COVID virus and should follow all isolation protocols. In addition to the COVID vaccine, another step to take to protect your health is having healthcare insurance. If you are already covered, you can stop listening now. But if you need health insurance, or if you want to check your options, the special enrollment period for marketplace coverage recently started. The enrollment period allows people to enroll in affordable health coverage during the COVID-19 public health emergency. People who are interested in this coverage can go online and see if they qualify for financial help to reduce the cost of monthly premiums. Just visit healthcare.gov or ciudadadelsalud.gov to review the 2021 health plans and prices and enroll in a plan that best meets your needs. It's important for everyone to continue using all the tools available to help stop this pandemic as we learn more about how COVID-19 vaccines work in real-world conditions. Experts are also looking at how many people need to get vaccinated and how the virus is spreading in each community. We don't know yet whether getting a COVID-19 vaccine will prevent you from getting or spreading the virus. So getting vaccinated is just one tool we have in minimizing the impact of this pandemic. For the time being, we still want you to follow all federal, state, local, and business regulations for social distancing. Thank you.